Good afternoon, everyone. I am Bree from Tendible. And before we start today, I'd just like to begin by acknowledging the Gadigal people of the Eora Nation, the traditional custodians of the land in which I meet you today. I pay respect to their elders, past, present, and future, and I extend that respect to all Aboriginal and Torres Strait Islander peoples on the call today. To start off with, on behalf of Tendible, Supporting Potential and NDS, welcome and thank you for joining us today. A special thank you to our panellists for taking the time to be involved in their thoughtful preparation. It does take a lot of work to pull these together. And in the biggest understatement ever, it's been a challenging 2 years, and we really look forward to some insightful and in-depth discussion around what we've all learned. It's really great to have everyone involved, so please ask questions in the Q&A, and we really want to continue that tradition of support and information sharing that's come out of COVID throughout the sector. And finally, I would like to introduce today's moderator, Angela Harvey. So Ange is the Managing Director of Supporting Potential, a consulting firm that focuses on creating sustainability for disability support providers. Ange has over 15 years experience in the sector, so including leadership roles in HR, quality and safety. So a big thank you, Ange. It's a lot of work that you put in today, and I know that you'll provide some great insight. So no further ado, on to Angela.
Thanks, Bree. Bree and Paul from Tendible have both put in a huge amount of effort to get this up and running today. So well done to you both, and it's been a pleasure to be a part of this. Thank you everybody for joining us today. I know that as soon as you mention the word COVID, people tend to get quite interested, and it has been the good, the bad, and what next. So I'm very pleased today that I've been joined by three amazing individuals who have all played a role over the last 2 years in the COVID response for supporting people with disability. With me today, we've got Jo Curnow from NNA Direct Support. NNA Direct Support provides one-to-one support for people with a disability in their homes. They provide a lot of support in our regional and remote areas, so she might be able to give us a different view for that. Also with us today, we've got Philip Petrie. Now, some of you may know him from NDS, but Philip is actually here today representing Allevia, who he is the CEO. Allevia provides support to people predominantly with intellectual disabilities and provides in-home services as well as capacity building. And last but not least, we've got Nicole Cook. Nicole is the GM of Quality and Safeguarding at Northcott and landed herself in the hot seat just before the final lockdowns happened in Sydney last year. So she's been thrown in the deep end. She's also worked with the NDA Contingent Care to provide further support to people with a disability. Now, I think there's a lot of debate out there at the moment about the government's response to the disability sector, as well as how the NDIA and the Quality and Safeguards Commission have engaged with providers. Today's session isn't going into that space. It's about what have we each individually learnt that can help other providers and make sure that we're providing a solid and productive service for the people that we support day in and day out whilst we move out of this process. So without further ado, as Bree said, the questions are there. If there is a question that's along the lines of our conversation, I'm going to try and slide it in. Otherwise, what we're going to try and do is the panellists will get together after this session and we'll attempt to answer your questions and send them out. So straight into the first question and following on with our headline, the good, the bad, and what next. Philip, we're going to start with you. What did you see as being something really positive that came out of COVID for your organisation and the people that you're supporting?
Thanks, Angela, and thanks for the introduction. Allevia has been through the pandemic in very, very similar way as everybody else. It was something that we were largely fairly unprepared for. And it was really interesting at the very, very sort of start of the pandemic. Like everybody else, we looked to government and we looked to our state and territory leaders to help us to sort of work out how we were going to deal with the particular situation that we were being faced with. What I think we learned very quickly was that as a sector, and as individual organisations, was that we had an amazing ability to show our own initiative and to be able to deal with the situations very, very much in an agile way and with a lot of innovation and initiative. And I just saw in my organisation a coming together really like never before of people who were so focused on ensuring that everybody that we supported was safe and that they were protected as best that we possibly could. And that level of collegiality within the teams was just absolutely phenomenal. So that, and I saw that grow consistently. It was almost like all of the challenges that we overcame strengthened those team bonds and really did refocus us on what exactly our role was in the community.
How about you, Joe? How did you find COVID positively affected your business? Because you guys literally only kicked off operations in February of 2020. So you didn't really have that longevity of people to rely upon. How did that change for you?
Yeah, look, I think that was probably the positive in it. I mean, there was, for us particularly, there was a level of fear where you launch a brand new arm of the business in February 2020 and COVID hit Australian shores in March 2020. So there was a level of panic initially, I think. But the good thing was, I think we were actually really well placed, given that our supports are one-on-one and in-home. There was a lot of people, particularly people with disability, living in the community or living at home with families or living by themselves, who had their normal sort of services placed on hold, or they couldn't go to their regular activities. And there was an opportunity for us to really kind of step in and work with people in a way that was really individualized, that probably, you know, we wouldn't have had capacity or room to do prior. So I think there was a lot of choice and control for people, particularly those living in the community in the initial stages. And I think that was one of the real positives, is that people did really get a chance to look at their services and supports differently. And I think for some people that's carried on. I think some people have made different choices moving forward that they might have been a bit afraid to do before then. I think also sort of, you know, building on to what Philip said, the collaboration with people and the agility is a massive thing. I think there's often a thought that, you know, in health and disability, it's sometimes like trying to turn the Titanic when you want to implement change. But I really think that, you know, the change, it was forced upon us, if you like, but the sector responded amazingly. That I've never seen people actually work so quickly, and the collaboration across the sector. So not just within an organisation, but collaboration across the sector. People were so much more willing to share resources and share knowledge and share, hey, this worked for us, or hey, we found PPE here. You know, there was literally, I think, like a Facebook group amongst providers saying, hey, we managed to get you know, gloves in this place, give them a go. We managed to get sanitizer. Hey, did everyone know Australia Post doesn't send sanitizer? So there was a whole heap of learnings that I think, you know, we just wouldn't have had otherwise.
Did you find that too, Nicole, in your role at Northcott?
Yeah, absolutely. I think whilst in 2020, and that's certainly before I started, we had a whole heap of I guess documents, procedures and guidelines in place about, you know, how to manage our COVID response. But what we've had to very quickly do, and which became a really positive flow and effect that enabled us to help other smaller providers, was that we very quickly operationalised all of those procedures. And in doing so, we could share, you know, all of those guidelines and templates that other providers may not have yet had the people power to actually develop those. We could share them and then also assist others with the coordination of responses. I think from a service delivery perspective, it gave us a great opportunity to be really creative. We thought of new ways, and one in particular with the therapy team was boredom busters, and we created a new way to actually still deliver our services but be really engaged and positive online. And I think that in turn in itself has a big flow and effect about how we're delivering our service, and then what actually maybe a result of that positive support in the home, rather than, customers at home being truly isolated. They're actually still engaged with their friends online. They're still engaged with familiar support. So that in turn, can reduce other incidents, for example, in the home from a safeguarding perspective as well. So I think lots of positive outcomes were there, but also the collaboration that Joe and Philip mentioned as well. I don't think we've probably in any sector seen the cross collaboration and active at all times of the day and night, being able to pick up the phone and ask for help. Or I've been able to find staff here for you with this provider, they can assist you. And it may not even be your shifts you're filling, but you're helping other providers fill shifts as well. And I don't think we've probably seen that before.
No, and I'd even take it the next step and say that it wasn't just within our disability industry that we saw the collaboration. We saw it with healthcare. We saw it within aged care. I think we worked out for the first time we were all in the trenches together, and there was only going to be one way to get out of it, and that was together as well. I definitely had conversations with our local health area network at 10:30 at night going, we've had an outbreak, what do we do? And they were super responsive. So this is meant to be an interactive session, and we're hoping that everybody out there will ask us some questions, but we want to get your take as well. So this is the take of 3 people that were very much involved in the day-to-day running of COVID, but as with you. So we're going to pop a poll up right now and ask you, what did you think the greatest positive impact was from COVID coming out? Now, we've given you 4 options there and then another one. So if you want to pick other, make sure you pop down your reasoning into the chat just so that we can start to share it. And as I said, we will be sending out some collateral information afterwards. So we'll be sharing these we'll be sharing the outcomes with you as well. So I'll just give you a few minutes to have a think, because yes, COVID has been scary. I've probably had more sleepless nights than I've ever had before in running this, as I suspect many of you have. But we have just heard from 3 people that have been very much involved about what the positive things are. And I think what we need to do now moving forward is work out, how do we hold on to those positives when we're not in a crisis? Because we do, as humans, we bring out our very best in a crisis. We show what we can do and what we're made of. But what we've got to work out now is how to move forward. So have we got the results there? Here we go. So our team worked really well together and went above and beyond. I think that's something that we saw time and time again. So these are not shocking responses for me. I was expecting to sort of see this. So thank you very much for sharing. Now on to the slightly darker side. So it hasn't been sunshine and rainbows. And Nicole, I might throw to you first. What's been some of the biggest operational challenges that you guys faced through COVID?
I think initially we had, like I touched on earlier, we had really great plans in place. Those really great plans, we hadn't actually had the opportunity at the time to operationalise the plans. So they might have looked good on paper, but once we started to work through the process, we found that as a COVID lead team, we had to be really fluid in our approach. We also found that we didn't have operational teams probably responding to us as well as they might have, because they didn't actually really know some of the people on our COVID team, because they were from roles like within my team, quality and risk, for example, or the comms and marketing team. So, what we found was we needed to speak our frontline workers' language better. We had to learn how to do that better. And the best way to do that was to bring in some operational leaders who truly knew their business, knew the people, knew the best way to communicate to the frontline workers in a crisis. So by bringing in those operational leaders, all of a sudden we found we were working better, so much more efficiently, the COVID team and our operational teams, because the language was a language that we all understood. We understood where our weaknesses were, what we needed to do to overcome those. And then also we needed to put in some strategies to make sure that we didn't have staff, whilst we might have had critical staff shortages in some places, we wanted to minimise risk of infection spreading. So trying to say, okay, Are we able to, in Sydney Metro, for example, actually have a worker, a frontline support worker, only work across 2 services? And then what's the impact if they don't work across 3 or 4? And how does that weigh up against the risk of working across multiple services? So I could probably talk to a whole heap of different things all day and how we came up with different strategies. But for me, I think the biggest challenge, but we did overcome it quite quickly, was just understanding what is the clear communication that our frontline workers will respond the best to. And actually, in understanding that language, we actually bring the crisis down from here to here. So it becomes everyday language, not everything's in a panic, everything's reactive, everything's a crisis. Let's just do what we need to do to better support our customers and each other. And I think once we did that, it was a much better approach.
And from a very tactical perspective, you had to get out a lot of information quite quickly. And I appreciate the comment about language, but what was the best mode of getting that information out? How did people respond through the different modes of communication that you used?
I think people just really wanted to see faces. They wanted to see and hear from people, because we could send out all the communication in the world and all the flow charts in the world, but when you're acting in crisis, you don't have the time to stop and read, take in, understand every single email that comes through. So we had, for example, if we had to quarantine, set up a respite house for quarantine for a COVID positive person, we would either have our clinical nurse educators go in to the respite house and actually go through the correct use for donning and doffing of PPE, not just sending out, here's a guide with some fancy pictures about what you should do, or here's the health video. If we weren't able to travel to the location, we would have a virtual Zoom. So again, it was much more interactive, but also what that meant was, because we were doing a one-on-one session with our staff, we could sympathise and empathise with how the staff may be feeling at the time, and also put their mind at ease in relation to supporting someone who might be positive and how PPE will protect you against that risk. So I think in person sort of, I guess it gave us an opportunity to truly understand how frontline workers might be feeling, and to put them at ease and to show them properly how to wear PPE. But also in doing that, that eliminates risk as well.
100%. Now, Jo, that's something that you probably would have struggled with in your business, in that you are one-to-one out in the community, and you've got workers spread all across 4 different states. So what were some of the challenges you came across through COVID?
Yeah, look, so many actually. I think the biggest obviously was getting PPE to people quickly, and as the rules changed, and even just understanding in the very beginning what PPE was required, and what people actually needed, and what type of masks were appropriate for, because really in the beginning no one knew what sort of level of protection people needed, and everybody, throughout COVID, the rates of Australia Post, everyone was shopping online. There were delays in postage, and sometimes things that would take overnight delivery previously were taking 4 and 5 days to get out to people. So definitely we had to be creative in each of those regional areas, find local providers of PPE. We, literally called people and said, look, if we give you a list of our staff, can they come in and get stuff directly from you? And we'll, you can call us while they're there, and we'll pay over the phone. And, we really sort of got creative with how we could get people what they needed. We also did things for some staff, we spoke to staff and said, look, the quickest way is if you're going to buy it yourself. We sent gift vouchers to people so they could purchase stuff, like from wherever they needed it, or, online sort of visa, whatever it was, to get people what they needed to be safe. The other big challenge that we've had is around obviously staffing. So nursing was a big one. We predominantly provide nursing services. So nursing, when hospitals put a rule that nurses couldn't work anywhere bar hospital, it made it really difficult for us to get someone to do a 2-hour or even less, a 1-hour wound care for a person living at home, where, you can't expect a nurse to give up a 12-hour shift in a hospital for a 1-hour shift with us. yeah, there were real challenges. Obviously, closing of the borders. We had no international nurses that previously, you know, we've used really successfully, and those things were a massive impact. But in regional areas, we suddenly had competition for regular staff that we'd never had before. So Mildura, for instance, is Australia's food belt, predominantly has used international workforce or travelling workforce for fruit picking, for instance. Suddenly, there were no backpackers traveling around the country, and we were suddenly competing with farmers for workforce, which we had never had to do before, and farmers who were paying probably more than they ever had before because they needed them. So we certainly had those challenges around those regional and remote areas that we wouldn't have faced in metropolitan areas as much.
And what were some of the things you did to combat that? How did you make your service seem more attractive than the higher paying fruit picking?
Yeah, look, it's been tough. I'm not going to say it's always been easy. It's definitely been tough. I think we learned very early on that, and not that we wouldn't always have done this, but more so than ever, we had to look after the people that we had, and we had to really spoil those folk that we already had, and make sure that, you know, that the farming was not more attractive for them. And so we had to look at ways that we could, you know, value add for people with training and with opportunities to, you know, in a very difficult situation, you know, down to sending people little care packages. I think we sent, you know, so many care packages of like a T2 tea bag and some, you know, chocolate and all sorts of things, just to say, hey, thanks. We know you're tired. We know it's tough. We really appreciate you. And I think it was just that genuine thanking people. I personally picked up the phone and called every single staff multiple times saying, how are you? Are you okay? Is everything all right? And, you know, things that I would normally leave to other people, I didn't. I jumped in and went out and did a few shifts myself, which I hadn't done for a long time.
I was going to say, that would have been a long time coming.
And to get back out there. But, you know, we did what we had to do. And you know, we've had some really great response from people. I think someone said about communication too, though. I think there was a level of communication fatigue for staff. We noticed at one point, you know, staff were so sick of opening emails with information. When we started to check our open rates, they decreased over time. I think there was a level of COVID fatigue. And we actually sent out, you know, we sent an e-gift voucher to every single staff, just a small one saying, hey, we just want to say thanks. Only 50% of people opened it in the first 2 weeks, wow. Which I found extraordinary. It was just, I think they were so fatigued from email communication and information. So we found we had to go back to the old fashioned, pick up the phone, call people, how are you doing? It was important.
Now, Philip, you would have had slightly different HR challenges, being like with sites in Western Sydney and the border closures in different LGAs throughout Sydney, as opposed to competing with farmers. How did you guys handle those challenges?
Yeah, workforce was a really interesting. It was a really interesting issue. COVID really forced us to be a lot more concerned and focused about engagement. And that's really interesting that Joe raised that issue around email fatigue and information fatigue. The other thing too was it was something that we really had to focus on very, very carefully, because the misinformation that is available through the fact that we've got a workforce that's so engaged with things like social media. It was about trying to make sure that we were always providing a trusted source of information, but not overloading people. So interpreting health orders was a very dangerous area, because if the moment you started rewording it for people, there was a real danger that you could actually take away very valuable information in regards to specific requirements that people had to comply with. So that became a very, very tricky area. Fortunately, we were able to work very closely with people within New South Wales Health, and we were able to give them some guidance about how they could actually word these things so that they were more accessible by our workforce. And being in Western Sydney, we've got a very diverse workforce too, where quite often English is a second language. So that became a number of different challenges. And New South Wales, to their credit, actually jumped on board and started doing things like producing health directives in different languages and guides and resources in different languages as well, which people were able to access. The speed at which changes happened was very difficult to keep pace with, because quite often you had to almost be providing information to staff before it turned up on the 6 o'clock news, because that would create confusion as well. So we had to be really on point with that one. We really focused very hard on ensuring that our staff really clearly understood that there were risks about working across multiple providers as well. Because one of the phenomenon that you find, I'm sure everybody knows this, you know, you half your workforce have got more than one job. They're quite often working across, and they may actually even be working across sectors. They could actually be working in hospitality. They could be working in a whole range of different areas. So that came with a whole set of risks, and we focus really on personal safety and family, and the fact that that situation created risks not only for the people that they were supporting in our organisation, for their fellow workers, but also for their home situation, their children, you know, their parents, all of those sorts of things. So we actually found, and I'd have to say the Allevia team were absolutely amazing. They actually stopped working across multiple services, and they actually said to other providers, I'm not available at the moment, particularly because we were actually really in the 12 LGAs of concern, right in the thick of the Delta lockdowns in Western Sydney. And they decided that they would just work at Allevia, and they were more than happy to just work in one site rather than working around multiple sites. So the people pulled together in that kind of environment, and it meant that we actually went through the entire pandemic to date. We've never used an agency staff member, and we've been able to rely entirely on our own workforce, even though we had 50% of our SIL residents exposed and infected with the Omicron strain just this last Christmas, New Year, and 28% of our workforce. So we were still able to get through on our own workforce, and that was really the team commitment to working for Allevia.
That's amazing. Is there something that you've taken from that? How can you get that longevity and commitment to Allevia to continue when the world reverts back to normal? Because that's the $1 million question, isn't it?
That is the $1 million question, and it's interesting. I'm actually speaking to you at the moment from an executive team lockdown, where we're actually sitting and exploring those sorts of questions about how we can take this forward. I was actually hoping that some of our participants today could be part of that discussion as well, because I'd be really interested to hear how other people are going to be able to do that. I think one of the things, though, that I learnt from the experience was that whilst it was really important to be proud of the fact that we went actually 20 months without any COVID, staff members or our clients. And we took a lot of pride in that. But what came with that also was a lot of fear in the workforce that, am I going to be the one that's going to break the record? And I don't particularly want that fear to be the reason why people want to just sort of, you know, do the right thing. And you know, I think really it does come down to motivation, but I think it also comes down to the fact that we're doing a lot of work at the moment about making sure that everybody's really fully, clearly aligned with our values and the reason why we actually provide services and why we come to work every day. So there's a lot of work going into just re-going over old ground and re-engaging with the staff.
I actually found that in my role heading up HR when the second lockdown hit, and we as well got COVID cases, and we had that challenge of, well, how do you continue to support people with active COVID? And what shocked me was the volume of staff and it wasn't because of who we were as the organisation, it was because of their relationships with the participants, and they wanted to see those participants healthy and happy. We had staff volunteering to live in some of our properties for the 2-week lockdown period. And it was just really phenomenal to see those relationships and what our staff would be prepared to do to help our participants. I'm going to jump to another poll because, as Philip said, this is meant to be interactive and we want people to be involved. And I've intentionally left a large portion of time to get to our what's next question. But before we do that, let's jump through, from your perspective, what's been the most challenging operational impact to come from COVID? Once again, we've given you some options, but there's also the other. So have a bit of a think, because I think this would look different for different types of providers and people working in different areas. And I'm going to give you guys a little tip. We're probably going to focus on the one with the highest points here for our start of the next session, which is what's next.
I have a question to answer for the panelists. I'm going to jump in. Just off the back of what you said, Philip, and open this up to everyone, has it changed how you recruit and what you look for in staff? Oh, and that kind of aligns with what everyone's put up in the poll too.
It has. I have a new COO who came to the organisation in the midst of COVID, and it was he was very quick to realign what it was that we were actually looking for and to look at the recruitment process. And what he was realising was COVID had kind of shaken the employee tree a little bit, and it exposed a lot of people for their commitment, their passion for the job, their staying ability. You know, there was people that said, I can't do this anymore and I'm out of here. And it was probably good that they were self-aware enough to make that choice. But it meant then that if we were going to look for a workforce that was going to stay the duration of this, because, you know, I mean, we've got experts saying to us that this is not over by any sense of the word, and, you know, let's look long term. So looking for people that are smart, that are extremely passionate and driven, so that they come to work for a reason, and are really focused on, or really are team players, were the three things that we shifted away from the old stock standard. You know, does a person have the skills and qualifications and whatnot? And when we focused on those three things, it really changed the actual demographic of people that we saw coming onto the team. And it's really strengthened our teams and really strengthened the workforce at Allevia as a result.
I think as well, Philip, it probably goes a step further in the fact that, you know, we've taken on all those approaches as well, but I also believe that we need to be prepared for our candidates to be interviewing us as an organisation as well. We need to make our organisation look attractive and supportive, so that people want to actually, particularly our frontline workers in support worker roles, we want to make it attractive so that this is not a temporary gig for them. They want to actually have a career in frontline support work, because we know that we have a high turnover of staff in that role. And we also know that the role competes very heavily with hospitality, for example, and even aged care. So we need to, you know, make sure as an organisation we're also attractive, that people want to come and work with us, not for us.
We totally agree with all of those things. For us, it was obviously, it's a little bit different given our geographical spread as well. But, you know, when I started, I had these grand ideas around recruitment, and the grand ideas, you know, our participants were going to absolutely 100%, you know, interview their own staff and meet their staff and all this kind of stuff. And COVID, unfortunately, we had to rethink that. And technology, you know, on top of all the other things everyone else has said, technology has been absolutely critical for us in making sure, we invested in recruitment tech that we didn't have before, down to, we invested in a bot to ask some initial values questions and things to kind of screen people first. We had to upskill our participants in teams and, set them up with technology so that they could be part of the process. And that it definitely has changed what the original vision was, but in some ways I think we actually do it better now than what we thought we would in the beginning. So I think there's been a lot of innovation in that space, to be honest.
And how do you deal with, so what I found when particularly the second lockdown hit, and obviously in Sydney, and I'm sure Melbourne would be the same, but I'm speaking from my perspective as a Sydney-sider, hospitality workers were coming out of the woodwork because obviously they couldn't continue to work. So in order to maintain their livelihoods, they were coming across to aged care and disability. How did you guys look to integrate them into your workforce? Because a lot of the workers that I found did have those things that Philip highlighted. They were team players, they were values driven, but obviously coming into a space where they've had no previous experience before. How did you go about inducting them and getting them up to speed quick enough?
I'm happy to jump in first. For us, definitely was that technology piece again. We found some good online solutions for training that were really interactive and that could be tailored to what we wanted. And we have had to do a lot more kind of, even with staff, technology-based stuff, and we've largely engaged our participants in, hey, these are your staff. What is it you want them? Let's set up a process of induction, and what are the important things that you want? We've really largely empowered participants to train their staff in those skills that they want them to have, and it's worked really well in a lot of cases, and lots of follow-up. How did it go? Did it work? What worked? What didn't? What did you like? What didn't you like? And kind of put, really giving people some of those things that we probably should always have done anyway, but it just kind of really, I think, pushed it forward.
I think one of the things too that's really changed is that at a management level, there's been, COVID's kind of forced us to be very, very, well, not so much protective, I guess, but very supportive of the workforce, because without that workforce, a whole range of other problems emerged very, very quickly, or were potentially going to cause a lot of problems. So having a workforce that was that was engaged and that felt that they were supported, valued, was really, really important. And one of the things that we did with our induction, we did the same thing. We brought on, technology's been something that I thank the heavens every day for the work that we did prior, the 18 months prior to COVID coming on in our technology space, and all the work that we did to embed a whole range of new systems into Allevia. And the connectivity from a technology point of view worked beautifully. But with the change in the way that we were onboarding staff, it meant that we actually diversified that one to being a lot less about how to do the job and a lot more about exposing people to the social impact side of it, and understanding the purpose for why they come to work and what it is that they're actually doing. And it was really the clients and the people that we support that told their stories and everything that kind of put the whole role into context. The rest of the stuff, the policies, the procedures, and the way that we go about it, you kind of pick that up really quickly by having really good support on the job. But I really think the context for these people that were coming into an environment that they didn't necessarily understand, they very, very quickly started to realize, well, okay, now I understand why I'm here. and what I'm supposed to achieve.
Nick, did you have anything you wanted to add?
Look, I agree with what Joe and Philip said. I think as well, for us, what was a little bit challenging was making sure that some of the essential training continued for staff, and particularly in the induction process, because we still needed to keep inducting new staff, but we needed to make sure that somehow the essential training, like, for healthcare training in particular, and then safeguarding training, things like that, we had to be really creative, like Joe said, to make sure that we could still do all those things, but in a meaningful way. So it wasn't just ticking a box to say that we did the training. We actually had to make sure that our new staff were well supported to understand why we were doing the training and then how to operationalise that as well. So being a little bit creative in how we delivered, I think, some of that essential training as well. We've now picked up and carried on to some of our induction processes too, which I think has been really helpful.
So one of the strategies we attempted, and it worked quite well, was we actually embedded the induction training into our recruitment process. So we had a 2-step recruitment process. The first step looked at values, teamwork, could you communicate? And then if you were successful in that round, you got paid for a 5-hour session to basically come in and participate in induction, so that we could actually see how well people were willing to engage with subject matter that might actually challenge them. For example, restricted practices is a great one. Oh no, they can't have Coke, so I'm not going to give it to them. Could they engage with the material around, well, no, that's a restricted practice, and if they want a can of Coke, they can have a can of Coke. So it was actually a really interesting way to approach it. And one of the other factors that we really built in, leveraging off Philip's point, was listening. So I think all too often we assume that people know how to listen. And I think the underlying message in that is people know how to hear, but do they really know how to listen? And it's teaching people to, A, listen to the client. As Joe said, they're the boss at the end of the day. They're the ones that should be directing their support. And it's understanding the difference between what is feedback versus what is a behaviour of concern versus what's just having a bad day, as well as listening to your colleagues and understanding where they're coming from, because the only way we get through this moving forward is to keep being a solid team, both within our small discrete teams at sites, our bigger teams as organisations, and the bigger space of the sector. What else? Sorry, Bree.
I was just going to say, there's a couple of comments just coming through, and it seems like the things that we're talking about wanting to keep staff engaged, and people are coming back with things like making sure you get that mix from work from home and technology. It sounds like there's definitely something there to take out and move forward in terms of re-engaging teams. Is technology going to be a bigger part moving forward, particularly for someone like Joe? I mean, it must be such a challenge managing individuals spread across this massive expanse of country.
Yeah, absolutely. And I think, if I'm completely honest, it wasn't our intention to do that at the very beginning. And remembering when we launched and when COVID hit, it's kind of been, we've gone where the need has taken us, if you like. So all of the original strategy that we had kind of largely, flew out the window, and we kind of have, taken opportunities where they've been available. And so, yeah, we've had to be quite responsive to that. And I think technology, definitely, we couldn't have done it. And, sometimes I look back over the last 18 months and think, why did we do that? We did it. There's certainly been times where we launched systems and technology in the middle of it. And, there's been some really crazy times where, and it's going to take us a while to catch up from that, because there were probably investments that we didn't plan to make for a period of time, but we had to make them quickly. And I think that's been a big thing for providers as well, is that you've had to invest in things that you probably didn't plan to invest in for a period of time. But the technology was so necessary during a COVID environment that you really didn't have a choice. And it's going to take, I think, a lot of providers, myself included, to catch up on that investment over time, and hopefully that investment will give us the opportunities to catch up.
So that's an interesting point, Jo, because nobody saw this thing coming and we were all reactive. What's the one thing that each of you have had a hand in deciding that you went, holy hell, how did what was I thinking, that's actually come out being a really good positive that you want to hold on to?
Why didn't I start a PPE business instead? Look, I think, I honestly, Ange, I could talk about that for the next 6 months. There has genuinely been some really big things, but you know, there's a saying, it's about opportunity, and you have to take the opportunity when you get it, and you can't look back and regret it. You've made the decision, you have to own it and you know, grow from it. I think that's the positive thing. Hopefully, you know, there's a little bit of time to breathe, and we can start to be a bit more proactive rather than reactive now that we're moving into, you know, a living with COVID environment.
Philip, what shocked you about some of the things that you had to decide?
I think probably technology is kind of the one that, you know, I got an email from a gentleman who, and I don't usually respond to unsolicited emails that are spruiking business. That's not my preferred way of engaging with other providers or vendors. And I don't know, there was just something about this email that tweaked my interest, and it took me down a rabbit hole that at the time I was really concerned about the amount of money that we were investing into our technology space as an organization, because we'd never done that before. You know, we'd always kind of operated on refurbished computers, and almost at some point, you know, a can and a piece of string was the way that we used to communicate with each other. It was that bad. And then to go and invest, you know, around about 3.5% of our revenue into IT was a massive decision to make. And it was interesting that I took it on board, and I did make some really spontaneous decisions at the time, but I was convinced by the argument that don't do it in retrospect, do it proactively, and be very careful about what you plan, because you don't want to be led down a hole and then have to try and back out, particularly with technology. So, you know, I was constantly sort of saying to myself, God, why am I spending this amount of money and everything? And then COVID hit and it all came home to roost. And I went, thank God I did that.
What about you, Nick?
I was just trying to, I can't recall a particular moment where I probably said, you know, thank goodness I've done that or made that decision. But I think there were many times where I found myself to be a more effective leader by jumping off the dance floor and getting on the balcony to actually have a look what was going on, because I'm very, very quick to roll my sleeves up and get in and do whatever needs to be done in whatever capacity. But a couple of times when I did that in leading the COVID response, then the direction or my, I guess, response became a little blurred because I was in too much detail rather than looking from above. In saying that as well, and I was, you know, encouraging the COVID team to do that to better support operational teams. I think in general, it was a constant reminder to be kinder to yourself. Be kind to yourself and know that it's okay to call out a bad day. Know that it's okay to actually say, I've just worked 14 hours. I don't have the answer for you right now to this, you know, 787th question that you're asking me today. And it's okay that you don't have the answer, because it's okay that someone else can answer for you, or someone else, you can follow it up the next day. So I think being kinder to yourself gives you an opportunity to make better decisions. And when you are kinder to yourself, you also remember that often better decisions come from cross-collaboration across different parts of your business. You don't have to do it all yourself. So I think they were probably a couple of lessons in general for me.
And I think that's a nice segue to our last 10 minutes, which is, I think we're all really tired. I think we're all got decision fatigue, and we've got the what's going to come next. And we're now also a little bit disengaged with the world. We've got floods that are killing people. We've got COVID that's going to come out. They're saying that we're going to have one of the worst flu seasons on record. So it feels sometimes like it's hit after hit after hit. But what next? How do we manage that moving forward, both for ourselves as leaders, as well as our frontline staff, and most importantly, the participants that we support? Because I can imagine that it's a very scary world for some of them at the moment too. So loaded question, guys. Multiple parts. Pick which bit you want to tackle first. And I'd love to hear from our audience on this one too. If you've got any suggestions, I think that'd be great to hear.
I think, and I actually heard this on a podcast I was listening to yesterday, and it was about not becoming complacent to crisis, but in fact, something that's happening to you right now as an individual that's causing you to have a really bad day. And that could be something very simple like, I don't know, I was wearing a pair of heels and I busted my heel getting out of the car on the way to work. It set me up for a bad day. And just allowing yourself to go, do you know what? I know there's a lot of bad things happening in the world, but for me right now, at this point in time, it's okay that I'm grumpy and upset that just happened. I know it doesn't compare to the war in Ukraine. I know it doesn't compare to all of the other bad things happening, but by being kind to yourself, it's actually okay to feel bad about something so trivial for that moment in time. And I think understanding and allowing others to have those thoughts as well, and sharing them openly as well, because if you're having a bad day for something, very simple like that, others are too, and that's okay.
Great.
I might just, one of the things that David White famously said was the antidote to fatigue is wholeheartedness. And I think at Allevia, we're in a bit of a hiatus at the moment. The floods isolated our head office for a few days, but we're not being directly affected. And we've got no COVID at the moment, staff or people that we're supporting. So it's almost like we've got this opportunity to create the diversion or the distraction. So there's a lot of things that we have in the pipeline. It's time to really start focusing on those sorts of things and even though we've got to not be complacent with COVID, we've got to make sure that we get on with life and we get on with business, and we take the opportunities that we've got to be able to focus on those positives. And I think the fact that we've got all these crises going on around us, it is very important that people are encouraged to be very focused on the positives that life has to offer at the moment. It's not all doom and gloom. And we're amazing people. We're an amazing community and an amazing nation. And we're notorious for being able to pull together and get through some of the worst things that the world can throw at us. So we'll do it again, but focusing on the positives is my little piece at the moment. That's very important.
Which leads nicely to a question from one of our, so sorry, Joe, I'll throw to you in a second, but one of our audience members has actually said, so how do you positively support participants moving forward? How has COVID affected that?
I think that potentially, the point I was going to make might go some of the way in answering that. I think for me, and particularly probably because of the type of work we're doing at the moment, and we're working with people that do have really significant kind of health concerns as well. I was going to say there's been some real challenges for people, as all of us know, particularly for people with a disability. Health equity is a real issue, and I think that's something that we can't let go of moving forward. I think there was a lot of decisions made during COVID that were decisions for, not with, and I think a lot of those were based on, you know, really poor data around people with a disability being a lot more vulnerable to COVID than the general population. But we don't have really clear data coming out from anywhere as to what exactly that looks like. And I think moving forward, we can't let go of the lens that we have to look at health equity for people so that they do have opportunities to live a good life like everybody else without the additional fear of my disability has made me more vulnerable. And I think not everybody with disability is sick, as we know, and that's, you know, this continuous kind of message that we need to actually look at what improves people's, and the collaboration I think is key. I think the only way we're going to get data is to collaborate together as a sector with health, with, you know, providers, with, you know, aged care even, and look at how do we get data and how do we give people the best opportunity of living a good life with COVID or with whatever else disaster comes along.
Wow, Jo. I think that is a fantastic way to end our session. It's a challenge to everybody out there to say, how do we actually bring our forces together and combine our minds to work out how do we bring this level of equity to people with a disability to make sure that they're not negatively affected moving forward. So that's the challenge that I'll leave you all with. I hope you've gotten something out of today. We'd love to hear your feedback. These things can only improve with the participation of more people and the contribution of more people. So please give us your feedback. And thank you very much for your time today. And thank you very much to my panellists. This has been a fantastic conversation, and one that I hope we'll have again soon in the interest of collaboration.
Thanks for having us, Ange and Bree. Thanks so much for organising.
Yep. Thank you.
Just a quick note for everyone who's on the webinar at the moment. As Ange mentioned at the beginning, we are going to collate all the questions that we've had come through. Our panellists will give some feedback and we'll make that available to everyone along with the webinar for anyone who wants to share it. So thank you all.
Thank you.
Have a fantastic Thursday, everybody.